Dus good morning. Good morning, Croatia. Good morning, HALMED. Good morning, Maja, and good morning, Maja. We are here today to reflect on your experience in making HALMED IDMP compliant and reflecting on a specific choice you made, which is to refactor completely your database. So you're part of Unicom, and I would like first to present shortly the two of you. We have today with us Maja Lovrek Romčević, and you are heading actually the Medicines Authorization Division of HALMED, Maja. So you have been also working for quite a time in leading clinical trials, and you joined in finally HALMED as head of the Medicines Authorization Division. And thus today you have a very critical and strategic role in the agency. And we have also Maja Fatiga with us, who is an advisor for software solutions. And you are currently working as a doctoral student, and you have been playing an important role as an advisor for software solutions, so in trying to see how to deal with the refactoring of the HALMED database. So with those few preliminary words, I would like to let you the possibility to introduce HALMED for our audience.
Thank you, Luke, for the introduction. And we would like to say hello on behalf of our agency, the Croatian Agency for Medicinal Products and Medical Devices, also known as HALMED. We are the competent authority in the field of human medicines and medical devices, but we also have certain tasks dedicated to the veterinary medicines. We were established in 2003. We are a self-financing agency. And since Croatia joined the EU on July 2013, we are the last agency to be joining the European regulatory network. Today we count around 230 employees. And when talking about the Unicom, we are involved in two work packages. The first one is Work Package 4, related to IDMP implementation at national drug agencies. And the other one is Work Package 8, which is related to clinical care, patients, pharmacies, research, and pharmacovigilance. Here you can see our organizational chart. The Medicines Authorization Division, which I'm representing today, is responsible for marketing authorization procedures from the very beginning to the end, meaning that we are responsible both for data entry, then for validation of documentation, assessment of documentation, all regulatory procedures, and at the end we issue the marketing authorization. In HALMED, our division is the business unit most dedicated to the Work Package 4, together with IT. This is because our division is responsible for the data on medicinal products, which are later also used by other units such as pharmacovigilance or laboratory. Maja, I give the word to you now.
Thank you. As Luke said, I'm Maja. I work in HALMED's IT as an advisor for software solution. My responsibilities can be described as a mixture of project manager, business analyst, and tester for HALMED systems related to medicinal product data. And I work on Unicom project in Work Package 4 together with my colleague Sanja Grčić-Plečko.
Thank you very much to both of you for introducing both HALMED and with more details, the two of you. Actually, as you know well, we don't have all European countries, and not all European medicinal products agencies are part of Unicom. You're part of the happy ones, if I can say so, well, of the 9 countries which are part of Work Package 4. So we accepted the challenge to actually start the process with Unicop of changing and adapting your internal database to make it IDMP compliant. So why did you make that choice? And why didn't you decide to wait so that everything is clear and that you just take on board whatever the others have done, and after they've experienced some very bad difficulties maybe, but why did you take the challenge from the start?
Yes, we saw this as an opportunity to connect with the experts from other NCAs who are also working on the implementation of ISO IDMP standards, because we wanted to exchange the experience, knowledge, and lessons learned. Secondly, we also wanted to be closely involved in the implementation to be able to have an impact on important decisions which are being taken on the EU level. Also, being part of a project with such impact is a great drive for us to accomplish the goals of complying with ISO IDMP standards, not only at the level of our agency, but on a broader national level. For us, for Croatia, this is closely connected with building a national medicinal database, which will be performed through other EU-funded projects. And lastly, by joining the consortium, financial support for the project of refactoring our medicinal product database, which is of course necessary in order to be compliant with the ISO IDMP standards, was provided. So being part of Unicom project is a great help for us on several levels.
Thank you very much, Maja. So actually, once you had some kind of idea of what this whole IDMP standard was about and what it could mean, you had to make choices. You first had to analyze what was your situation considering that standard, and you had to make choices. So what is the choice you have made and why?
So, as you said, our main plan is to refactor our currently used database and upgrade our user interface. You see, in 2010, HALMED started to build its own IT system to support marketing authorization process through central system for marketing authorization case tracking called NRL. It was decided that the medicinal product database should be based on the data model described in RDM 3.0 model, so-called reference data model published by EMA, and that was confirmed as a good practice at that time. Of course, over the years, our internal system, built to support medicinal products marketing authorization processes, has grown, and it became integrated with 2 other internal systems covering pharmacovigilance and laboratory processes that rely on that same medicinal products data. Therefore, based on detailed analysis of our central system, we've concluded we wouldn't be able to capture all the necessary data if we are not in compliance with the ISO IDMP standard. But since our current system is extremely well adapted to business processes, our final decision was to go further with the adaptation of current database instead of building a new one from the scratch.
Okay, but that probably was that was not easy. So
No.
How have you then tried to approach the issue? What has been your roadmap to approach the refactoring of your database, and what are the steps you have in mind? What kind of methodology have you implemented?
Yeah, we have a few phases we are trying to implement. Firstly, as mentioned before, beside the detailed analysis of ISO IDMP data model, IDMP implementation guide and fire message, also our internal processes were assessed, as well as data sets required by other healthcare stakeholders in order to define our medicinal products master data set. Throughout the analysis of processes utilizing that medicinal products data, a detailed comparison of our current data model with ISO IDMP standards was performed in order to detect the gaps in our model. In our case, we've concluded that these significant changes are needed in the part of packaged medicinal products. To be precise, we need to include the introduction of manufacturer item into our current system. Some changes in the way the composition of medicinal product is recorded, as well as changes on the part of capturing data related to pharmaceutical product. Furthermore, refactoring our internal systems also, as I said before, requires a thorough planning of the user interface reconstruction. Fortunately, since the beginning of development of our internal database, certain UTCT lists were used, but for some processes, we've created custom-made lists. Therefore, the transition to RMS list is ongoing, as well as the action of data standardization, data mapping, and cleansing. For organizations, we establish a connection with OMS in order to link the organization and their locations recorded in our database with the org IDs and log IDs in the OMS. However, the data mapping for organization is still in progress. For substance and pharmaceutical products database implementation, we are waiting for further information on the EU level regarding this topic in order to proceed.
Thank you, Maja. You mainly base yourself on the first implementation guide, which has been published by IMA just as a source, as a main source of input, of inspiration for
Yes.
it. Do you consider that, well, you have there is enough stability today to engage yourself in a very complex process like the one you have been in this? And do you believe that you will be able to handle any possible further adaptations? And
yeah, that is our plan. And of course, there are major challenges we need to take into account. And also there are much resources that had to be and still have to be invested. Firstly, as I said, in order to be sure that all the aspects are thoroughly analyzed, which also includes ISO IDMP standards, EU implementation guide, current data model and functionalities in our system, business process and use case scenarios. It is very important to have the commitment from the top management that the key business users and subject matter experts will be engaged on the project when needed. Fortunately, in our case, adequate support was and is provided. Secondly, as you said, having IDMP implementation guide prepared by IMA was and is of great help when architecting our data model and planning the user interface reconstruction. Nevertheless, it is quite challenging to implement the guidelines into practice, taking into account that besides mandatory data suggested through implementation guide, we had to also thoroughly analyze all our business processes, and that includes from case tracking for marketing authorizations procedures to pharmacovigilance processes, official medicines control laboratory processes, and the process of calculating maximum wholesale price for a medicinal product. And even more, we had to think about national-wide medicinal product data usage in order to define master data set for medicinal product identification. While analyzing all the business processes and the data set required for IDMP implementation guide, number of processes were analyzed in work groups consisting of business users, subject matter experts, and business analysts from IT department. Based on that discussion results and on agreed conclusion, some processes were adjusted, some were improved or optimized. I have to say that on the top of the Unicom financial resources, HALMED has its own yearly resources used for the maintenance and upgrade of our IT systems, which is, of course, a significant benefit. But throughout the whole process, we are becoming more and more aware of the importance of data quality. So, Maja, could you please just say us something more about our approach to data quality insurance?
Yes. Well, the medicinal products data stored in our internal database is sent to medicinal product database on the HALMED's website, and will also be sent through services to national medicinal product database in future. These are the two most apparent reasons at this point for the public why data quality is so important. Fortunately, we have a team of 3 employees within the Medicines Authorization Division who are dedicated to the work of our internal database and medicinal products data quality. They also collect and prioritize business requirements. They test the system, provide support to the end users, and they are responsible also for data mapping and cleansing. They, of course, collaborate closely with our IT department on daily basis. If we talk about introduction of SPOR RMS, for example, HALMED has been using the EU TCT list, as already mentioned, from the early stages of internal system development, and those code books were synchronized on a daily basis. However, until recently, it was allowed to add user-defined terms in our code books. So now we are prioritizing the introduction of SPOR RMS lists, taking different things into account, meaning the scenarios of how prior code books were used, and of course, which new processes or new data are introduced into the system that could lead to introduction of new RMS lists. For the RMS, we performed data cleansing for user edit terms. We deactivated user edit terms and disabled the possibility of adding new custom terms in the code book. And for these processes, we have a custom-made administration tool developed by HALMED and external colleagues.
Thank you very much. What I hear from you today is that actually, well, you one of the key success factor for implementing or making IDMP, making your database IDMP compliant is, first of all, that you actually got the support both from all the staff from the agency. You've been working really as a team. You allocated specific resources to it, so you've been really led a strategic project in the agency, and you also got some kind of political support for it, so that that sufficient resources would be there. Is there any other aspect you would like to mention as a critical success factor when you are implementing such a challenging project?
Yeah, I would agree with you, Luke, and I would say 2 things are on top of my list. Surely there are more, but firstly, I would have to emphasize that learning from each other and sharing experience between the partners on Unicom is a crucial and probably most important benefit Unicom is providing for us. Secondly, as you said, cooperation of everyone involved, especially between IT department and business experts, and of course, sponsorship by the top management, as stated before. And if I may, I would like to say that we here in IT department are very grateful to Maja's team for engaging subject matter expert in the process of analyzing data model for medicinal product identification.
Thank you. And actually, I would like to finish with a question which is important. And when we discuss with some other agencies, they speak about it. Yeah, you know, we've done a lot. Actually, we have everything we need to support all our use cases in our country. So now still changing anything and so on. Yes, but what will be the benefit? How can I convince my policymakers to again invest in adapting what we already have? And actually, that question is really crucial. That's about the role that a national agency like yours is playing in the global ecosystem in order to have medicines flowing, medical data related to medicinal products flowing in the whole system in a way which is meaningful. So with the necessary quality that you already mentioned, but so that actually you are taking the role of implementing interoperability at the source, if I could say so. So is this role already acknowledged for HALMED in Croatia? And are you a key player in the e-health ecosystem in Croatia today?
Well, I would say yes, because the standardization of the data, which is performed now for the purpose of agencies' processes, will have a direct impact on a broader national level, since the data will be used in the national medicinal database in the future. And this national medicinal database will be used throughout the Croatian healthcare system. So in fact, we see this whole exercise as paving the way in the national system, which will make it easier for other stakeholders to use in their business processes.
Thank you very much, Maja. I think that your testimony today is extremely helpful, and I would like to finish with maybe providing you with the opportunity to tell that you made a big effort in trying to put in writing all your experience, and I think you're the first agency in Europe to do so. So you actually published an article. I will show it. Sorry. And this article is, I think, publicly available. It's published on the Unicom website. So maybe as a very last question to you, why did you decide to do this exercise of actually producing a complete documentation?
I just want to say that a big part in this article had my colleagues, Sanja Gačić-Plečko and Dubravka Sudić. And our main goal was to describe our experience and to show others what we are doing, how we are doing, to state the challenges we had and we will have. And we just wanted to show others that we are doing important things. Through Unicom is a project who is making changes that will be important in the future. So one way of showing the results, and that are only part of the results, we've described in this article, and also presented on the conference in Porto called eTelemed.
Thank you very much. So I really advise everybody to have a look at the article, which I found personally extremely informative. It contains very detailed information on both on the methodology, on your approach, but also on how you've been concretely making the changes necessary. So thank you very much to both of you for this testimony, and I wish you all the best for the last steps, which are probably still numerous.
Yes, they are. Thank you very much, Luke.
Thank you, Luke. Goodbye.
Bye-bye. Let me stop.